Good afternoon, I am Vicky McCullum with the Thursday edition of the Our City COVID-19 News Show. We will be updating you on the latest information and resources around the COVID-19 pandemic while unpacking deeper issues as they emerge. We encourage you to get in touch with us. We want to hear from you as we welcome contributions from movements, healthcare providers and our audience. We want this program to be a two-way flow of information, so please get in touch with us. Is South Africa ready to send back its pupils to school? Well, that is the question we're asking today. So send us your thoughts on all our social media platforms. To help us unpack this controversial topic, we will be speaking to Sarah Black from the COVID-19 People's Coalition on the matter. Moving to today's news. It is day 42 of the lockdown and the current number of COVID-19 cases nationally stands at 7,808 with 3,153 recoveries and 153 deaths. The Western Cape currently has 3,771 confirmed cases of the virus, 1,122 recoveries and 72 deaths. Police have called for help in identifying two men suspected of being behind an attempted murder in Innervar Street, Higgovale on the 9th of April. Two suspects wearing face masks approached a 65-year-old lawyer at his residence, firing several shots at him. They missed and the complainant survived the attack. 3 days before the incident, the suspects were captured by surveillance cameras in the neighborhood, being dropped off in a white late model Hyundai Credo with no number plates in the front of the rear. If you recognize the suspects or the vehicle shown in these images, please contact Colonel Eddie Clark on 082 469 1531. A private hospital in Gatesville has denied it threatened to fire nurses if they spoke out about cases of COVID-19 being treated at the facility. Nurses told the Daily Voice they did not know if patients they were caring for had the virus and that a few among their number had fallen ill. Melomed spokesperson Shamima Adams declined to comment, saying healthcare facilities were prevented from doing so by law, as only the National Institute of Communicable Diseases was able to communicate on COVID-19 positive cases. South African engineers and doctors are designing makeshift, inexpensive devices to address a major challenge posed by the coronavirus, the lack of ventilators for patients. South Africa is scrambling for thousands more ventilators as confirmed COVID-19 cases have increased to 7,808, with at least 153 deaths.
Ventilators are complex and expensive machines that are badly needed to treat COVID-19, especially in developing countries like South Africa. While South Africa is the most developed nation on the continent, it is also the worst hit by the virus and needs thousands more ventilators. To address the shortage, South African doctors and engineers are teaming up to create inexpensive emergency ventilators that are portable and easy to use.
What we set out to do was originally to have something that is affordable, that is indestructible, and that's obviously pretty cheap. And that's when we set out to actually start with the design on the O2 box.
Developed by Dr. Jano de Beer, the O2 box cost about $220 compared to tens of thousands of dollars for a standard ventilator and can run on solar power, dual voltage, or even off a car battery. But the inventors note the O2 box is not meant to replace a standard ventilator, just to act as an emergency device or last resort.
Using that with the fact that it's quite inexpensive, allowing a person that might otherwise not be able to get a ventilator, that because of reasons of not fitting the protocol of age, disease progress, of prognosis, having that person have a fighting chance with a ventilator that is inexpensive.
A team from the University of Johannesburg is also working on their own inexpensive ventilator that is open source design.
So in that sense, or from that philosophy, the purpose of the university is then almost to form sort of a think tank or an idea innovation hub where we can develop these technologies and send them out into the world where people can hopefully use them.
While still at the prototype stage, De Beer and Hill expect to produce up to 3,000 O2 boxes per week by the end of May. The emergency ventilators can't come soon enough. South African medical experts say the nation peak in COVID-19 infection could come as early as July or as late as September. Franco Puglisi for VOA News, Johannesburg.
Meanwhile, 30 emergency medical service workers went on strike last week over an inadequate supply of personal protective equipment. Now, the Western Cape Health Department has secured 102 million rands worth of stock for medical workers, with more on order. Premier Alan Windey said the department was preparing for the peak infection period and had developed a dashboard allowing them to track the stock holding of each type of PPE. Full PPE kits are given to medical workers conducting tests and treating patients with COVID-19. A senior inspector from the Labour Department has accused officers from the Metro Police in Cape Town of obstructing him from conducting a COVID-19 risk assessment at its offices. Unions representing members of the Metro Police accused the city of failing to comply with the Occupational Health and Safety Act. Spokesperson for the City of Cape Town, Priya Reddy, said all staff had been issued with the necessary personal protective equipment in the line with the required risk assessment conducted and had been informed and educated about personal safety precautions. She said the city had closed each and every facility where an employee had tested positive and would continue to do so. It's time for an ad break. We'll be back shortly. Welcome back. You're still watching the Our City COVID-19 show with me, Vicky McCullum. We will be giving you the latest updates on the COVID-19 pandemic and sharing essential resources and information with you. The C19 People's Coalition ECD and Basic Education Subgroup believes the government should not allow children to return to school. The coalition raised concerns over the Basic Education Department's presentation to the Parliamentary Portfolio Committee on Basic Education at the end of April. We spoke to the coalition's Sarah Black to find out more.
Good afternoon. I'm joined by Sarah Black, official spokesperson for and representing the COVID-19 People's Coalition. Sarah, you're part of the ECD and Basic Education subgroup, am I right?
That's correct, yes, Helga.
Sarah, before we start and get into the question of education, tell us a little bit firstly about the COVID-19 People's Coalition. Who is it, where did it start, and what are they talking about?
So my limited understanding of the very broad coalition, which includes more than 300 different NGOs, institutions, and civil rights organizations, is that it's basically a collective in the pandemic moment to make sure that the kinds of efforts and organizing across disparate aspects of social need are coordinated, and that issues that need to be brought to bear on policymakers or to speak to social justice issues happening on the ground come with a unified voice. So, we'll have a lot of different sub-working groups. There's one on gender, there's one on labor. There are two education groups. One is higher education or post-school and non-formal education. And then there's ECD and basic schooling. And really, it's the large civil society that we have active in South Africa trying to make an effort to be a little bit more coordinated across what is a very broad church of organizations and institutions.
So Sarah, coming to the work of the subgroup on basic education, on ECD and basic education, Earlier, a few days ago, the Ministry of Basic Education presented recommendations and a plan, if you like. The position of your sub-working group is that it might have caused a little bit of confusion because it was not clear on the way forward for basic education. Tell us what your working group's response has been to that, and why have you come out against some of those recommendations?
Um, so I think there are two aspects to our concerns, Helga. The first is the feasibility of what is proposed at all, given the material constraints on the ground and the Department of Basic Education's inability to make these things happen over a much longer period of time. Just the Mail and Guardian was saying, how can we achieve in 2 weeks what we have failed to do in 7 years? So there are the timeframes, which are, so that's the second thing, is the timeframes. Sort of the idea that what was presented to Parliament was about May. The confusion was, of course, that the next day the minister came on board and said, no, that those dates were just part of a suggestion and were not set in stone. But that is a very confusing message, given that presentation to the parliamentary committee was broadcast on live free-to-air TV to the public. So there's two aspects. The first is the timelines that were presented, and the second is just the overall plan and its feasibility. We came out in our statement highlighting not just the issues that relate to the pandemic in and of itself, but we called for a just return to schooling, not just a safe one. We know that the issues that are creating a problem for delivering safe schooling in the pandemic moment are not unique to the pandemic. They have been fermenting and deepening inequalities and crises in our schools for the last 20 years. That those now just kind of get ignored or swept under the carpet or wished away it can't be pragmatic and meaningful policy making. It's just not. It's a wishful list. It's a Christmas list of wishes, not a pragmatic approach for schools and senior management teams to get behind when it comes to opening schools safely for their children.
Sarah, one of the issues that you raise in your response has been the conditions under which teachers also have to return to school, particularly teachers who already might have compromised immune systems. Tell us what your position is on that.
So one of the things that is very clear in education research internationally over the last 20 years is that we've kind of got the general public thinking in an us and them kind of relationship between the well-being of students and the well-being of teachers. And that's not the case at all. Healthy, well-supported, equipped teachers equals better learning. The idea that you now need to take away from teachers in order to give to students is a really very destructive type of logic to be thinking about. So one of the things that we're saying is, how can you possibly thinking about opening schools in a way that is safe and just for students when the teachers who are meant to be taking them through their day-by-day lessons are at risk? You can take that from the sort of minor perspective of saying, well, teachers who fall sick are going to have to stay away from school, and that's going to create a lost lesson time as it is, all the way to the much more serious concern about the mortality rate of COVID with people who present with comorbidities. And what we have an aging teaching population, and we know that we have high comorbidity rates, not just amongst our teachers, but amongst a lot of our population. So given that South Africa already has a teacher shortage problem, we should be really thinking about protecting the teachers we have and not exposing them to the types of risks that might present with a very severe crisis.
So the COVID-19 People's Coalition, and specifically the sub-working group that you are part of, you are recommending to society that we have a moment in which we could correct the injustices of the past, particularly in basic education. But let's talk about the present time now, Sarah. The most anxiety-ridden moment, I think, for grade 7 and for grade 12 parents is the issue of examinations. What is the People's Coalition? What is your position on examinations in the 2020 academic year?
Our position regarding assessment and curriculum is that any pretense that we can have the types of examinations and assessments that we would have in a normal year is again wishful thinking. That's not only just about the amount of time that's already been lost, It's also about the types of psychological strains that students will be under at the moment, especially students whose families are vulnerable. You don't know how many of those grade 7s and grade 12s are now in households where their moms and dads have just lost their jobs. We don't know how many of those grade 7s and 12s are in households who have lost someone to COVID. And anyone who's tried to undergo high stress exams under conditions like that knows that it impacts on the child's performance, their cognitive recollection, and their ability to perform fairly. So I think the idea that between the time we've already lost, the time we know we're going to continue to lose, because schools are not going to be able to just remain open once they're open. As hotspots flare, things are going to ebb and flow. Professor Mary Metcalf mentioned that the other day on the SABC. The idea that schools won't shut again is not something we can guarantee. So the idea that the assessments that have been set, especially for grade 12, can go ahead as planned, like the minister said, I'm really not sure how they're imagining that's going to happen in a fair way on this cohort of students. We don't have all the answers with the coalition, but we're saying that we could get a lot more creative to say, what could we present as an acceptable form of assessment for that cohort? Should we assume that this academic year can be rescued? Because that's also an assumption that's not necessarily agreed on by everybody. And what might that other alternative assessment look like? And how can we bring the people who consume those assessments on board to accepting that what they're going to get from this year is different, whether that's universities, potential employers, or high schools?
So Sarah, you're saying this is a moment for us to rethink. It's almost a moment of rejuvenation if we grab it. Last point, the People's Coalition, your position on education in particular is prioritizing life and health. You're saying delay school reopening?
I and my colleagues, I'm sure, are of the opinion that the opening of schools is a lot more fraught than that presentation to Parliament suggests. The subsequent statements by education teacher unions, individual principals, and concerned parents is this is a premature plan. We're not ready to go back to school. It's not safe for our children. It's not safe for our teachers. And we're still going to see how that comes out in the wash as regards the positions stated by the DBE, some of the positions articulated by the provincial education departments, and the unions and parents in schools. But there is no consensus right now that reopening schools is the right thing to do or under what conditions to be done. And that lack of consensus to me indicates that there's a lot more conversation to be had before people can reunify in schools and reapply themselves to the project of education, however that might change.
Sarah Black, thank you very much for speaking on behalf of the COVID-19 People's Coalition. We wish you and the subgroup all the best as you help to guide us in this very, very fraught moment.
The Strandfontein temporary shelter for street people has become one of the most talked about stories since the start of lockdown. We spoke to one of the street people who lived at the Strandfontein shelter. This is what she had to say. The source asked to be kept anonymous.
I moved to Strandfontein from the day one, and it was disaster waiting to happen, man. From the wet cold, when we got to Strandfontein, the tent was like empty. It was nothing at all, almost like not even like fully done, like half finished. And then they, when we entered, there was no proper screening. They would just like ask you random questions, which questions like I believe that other people, like, cause they would be like asking you if do you cough, do you sweat at night, and a lot of people at the time were like, nah, I'm not coughing, I'm not sweating, because probably they thought maybe they were not gonna make it through. So everybody was like, no. And all along, like almost quarter of the tent is actually suffering from TB. And we were like over 500 people there. And in one tent, no blankets, no mattresses, no nothing. But luckily for us, people who came from Kulenburg, we managed to bring our little small tents along, our like 2 sleeper tents along. So there was death, man, from day one. We woke up like when it was like a breakfast time. we woke up and there was a dead man sitting around about 8. And when they looked at him, the guy was like glue, you know what I mean? Which meant that it's been some time since he has passed on, but they only removed the body, say I'm sure the body was there for something like 8 to 9 hours in the same tent that we were eating in the same tent where Mr. Khan, the president or CEO or founder, chairperson of the Haven Shelter, where he kept on lying to people, making promises as if there was, everybody in the room was alive, whereby there was a dead man on the floor. And say maybe we were like 10% women and 90% guys. And, in the same space, we have you're mentally disturbed. We have your disabled, clients. We have your elderly. We have your gangsters. You know what I mean? We have your 26s. We have your 27s. We have your 28s. In the same space.
Public Enterprises Minister Pravin Gordhan has held a virtual meeting with Parliament's committees charged with oversight of public enterprises on developments in state-owned enterprises, including SAA. Here are some highlights from that meeting.
Know that historically SAA has been a good performing airline on the one hand, but also one that has a history of mismanagement, and as a result has declined in performance over many years. And of course, it was badly affected, or wrecked as I call it, during the period of state capture as well, whether it is SAA the airline, SAA Technical, which was a superb international facility in terms of maintenance and repair of aircraft, and which today also finds itself in some difficulty as well. The business rescue process itself is one where, as I said, the role of the practitioners is to restructure a business to, inverted commas, rescue it so that it would operate normally. The business rescue practitioners are still in charge of SAA, although the board is in place, but they are the effective bosses on a day-to-day basis, and they make the decisions. An amount of 5.5 billion rands from 2 different routes was made available in December and soon thereafter for post-commencement finance. And so 5.5 billion rands has been spent in the last 5 months, something that we've been questioning in terms of the sole discretion that the BRPs have in terms of legislation, although the PFMA and so on apply to them as well. But these are matters of accountability that we are getting into and have been interrogating for a little while. So as I was saying earlier on, that virtually total grounding of major airlines has occurred. Loss of staff has been a feature. The spread of the infection by air travel is a risk that most countries are afraid of. The colleagues in the... Okay, now they're getting to SAA. And therefore, many borders across the world are either totally closed or significantly closed, pretty much like South Africa. And even in traffic in the so-called Western countries between Europe and the United States has been interrupted as a consequence as well. The best wisdom in this regard from those who are familiar with the aviation industry is that it will take a very long time before the industry recovers. The view is that domestic will start off on a slow basis, regional, whether it's in the continent here or Europe or elsewhere, will be the second starter, so to speak. But one of the challenges in terms of the business model that would be affecting the airline industry is how do you achieve social distancing? And so if there is to be a 1 to 2 meter distance between every passenger that's on an aircraft. So think about the last time you flew. you'll probably have a 30% or so load factor. In other words, for every 100 seats on an aircraft, only 30 people will be sitting on a seat because you've got to keep your distance, wear a mask, and take the other precautions that need to be taken. It then means that the cost of travel is going to be phenomenally higher, and it will also begin to impact upon the profitability of airlines as well. So in many cases, it is predicted that anything between 18 and 36 months is what we're talking about, maybe slightly less when it comes to some domestic travel in some countries. But if you're talking about international travel on the kind of scale that we've seen before, it's not going to be anywhere near that which we've seen before. And organizations like IATA on the aviation side, WHO on the health side, have all made their calculations and presented various models in this regard. And so international will be a slow starter, and many planes will remain on the ground, whether it is in factories that produce them, in Seattle or in Paris or whatever the case might be, in the case of Boeing and Airbus. But we also know that airlines that have ordered aeroplanes were about to take delivery prior to COVID-19 are no longer taking delivery. And so that has consequences for the airline industry in terms of the manufacturing side of the industry. But if somebody has enough money, then now is the time to start to make some deals in terms of refleeting an airline, if you have the cash, and getting the appropriate aircraft for the kind of routes that you actually want to travel. What should the shape of a new airline be? And we've invested, as a department, a fair amount of energy, time, and the retention of experts to give us a design of a potential future airline, which would be completed shortly. And so what's the migration route from between where we are at this point in time and where we want to get to? But the one thing that we must be absolutely clear is that the old SAA as it exists will not exist into the future. Partly for the reasons that it was not competitive and unviable as it was at that particular point in time, but also because of the whole environment, both within aviation and in the economy more generally, has changed very significantly. And nobody can quite anticipate what air travel is going to be like even 2 months down the line as we go.
To date, the World Health Organization has recorded over 3.5 million COVID-19 cases and around 250,000 deaths. Now let's cross over to the WHO's media briefing held yesterday.
More than 3.5 million cases of COVID-19 and almost 250,000 deaths have now been reported to WHO. Since the beginning of April, an average of around 80,000 new cases have been reported to WHO every day. But these are not just numbers. Every single case is a mother, a father, a son, a daughter, a brother, a sister, or friend. Although the number of cases reported from Western Europe is declining, more cases are being reported every day from Eastern Europe, Africa, Southeast Asia, the Eastern Mediterranean, and the Americas. However, even within regions and within countries, we see divergent trends. Every country and every region needs a tailored approach. But the impact of the pandemic goes far beyond the numbers of cases and deaths. Around the world, the pandemic has caused severe disruption to essential health services, including to community-based health care. Also, professional health workers like doctors and nurses play crucial roles. In many countries, trained members of the community play a vital role in delivering essential health services like vaccination, prenatal screening, and the detection, prevention, and management of many diseases. Today, WHO, UNICEF, and the International Federation of the Red Cross have published guidance for countries on how to maintain community-based healthcare in the context of COVID-19. It includes practical recommendations for countries on sustaining essential services at the community level, leveraging community health workers for the response to COVID-19, while keeping them safe, and advice for how to adapt services for specific diseases and age groups. For example, it suggests using telemedicine wherever possible and leaving insecticide-treated nets for malaria at the door of households instead of asking people to collect them from a central location. It's also vital that countries pay careful attention to the most vulnerable members of their societies. Crisis can exacerbate existing inequalities, which is demonstrated in higher rates of hospitalization and death among certain populations in many countries. We must address this now and in the long term by prioritizing diagnosis and care for those who are most at risk. This is not only the right thing to do, it is the smart thing to do. We cannot end the pandemic until we address the inequalities that are fueling it. Today's guidance complements the United Nations Framework for the Socio-Economic Response to COVID-19, published last week. The framework lays out a recovery roadmap for countries to protect lives and livelihoods. I repeat, lives and livelihoods, and get businesses and economies up and running again as soon as possible. Importantly, the framework takes a health-first approach, recognizing that strong and resilient health systems must be the foundation of recovery in all countries. As more and more countries consider how to ease the so-called lockdown restrictions, I want to reiterate the 6 criteria that WHO recommends countries consider. First, that surveillance is strong, cases are declining, and transmission is controlled. Second, that health system capacities are in place to detect, isolate, test, and treat every case and trace every contact. Third, that outbreak risks are minimized in special settings like health facilities and nursing homes. Fourth, that preventive measures are in place in workplaces, the schools, and other places where it's essential for people to go. And fifth, that importation risks can be managed. And sixth, that communities are fully educated, engaged, and empowered to adjust to the new norm. The risk of returning to lockdown remains very real if countries do not manage the transition extremely carefully and in a phased approach.
After the break, Octavia and Lovu will take a look at what's happening on social media.
Welcome back. Before the ad break, we had Vicky McCullen with the latest news. The following PSA was created by the Khayelitsha Action Group. We need need to take collective responsibility to protect ourselves and others from contracting COVID-19. Please follow these instructions and help flatten the curve.
Singabahlali baseKhayelitsha abaxhalabileyo ngale ntsholongwane icorona. Izinga labantu abosulelekileyo lenyukile kwaye liyaxhalabisa kakhulu.
Kodwa akumelekanga nipenike. Nto nje into ekumele niyenze kukumamela imiyalelo karhulumente yokuzikhusela ngandlela zonke.
Sisicelo ukuthi sonke kwindawo esihlala kuzo ukuba sithathele ingqalelo lentsholongwane yecorona.
Xa silandela imiyalelo nemiqathango singakunqanda ukunwenwa nokusuleleka kwale ntsholongwane.
Le ntsholongwane yosulela lula kakhulu. Masizikhusele kuyo, sikhusele nabanye abantu ngokuthi silandele imiyalelo karhulumente.
Le ntsholongwane ihlala amaxesha amade entsuku kwiindawo ngeendawo.
Ngoko uyakwazi ukosulela nokosuleleka xa ubamba izinto nendawo endlini yakho naxa ubamba iindawo eziba nabantu abaninzi.
Ukumela kude kwabanye abantu nokungabambani ngezandla kuyanceda.
Kubalulekile xa ukhohlela usebenzise umphakathi wengqiniba ngeli hlobo.
Zama kangangoko unako ukuzikhusela ukuze ungayifumani intsholongwane i-coronavirus ngokuthi ungabambi ubuso bakho, ingakumbi umlomo, impumlo kwakunye namehlo.
Hlamba izandla zakho for 20 seconds ngamanzi nesepha.
Siyayazi kwindawo esihlala kuzo kuba amanzi afumaneka nzima okanye awekho. Lo ngumcelimngeni sithi urhulumente makawulungise.
Kodwa xa ukwazi ukuwafumana amanzi nceda uhlambe izandla zakho kaninzi ngosuku.
Sikhathalele, sikhusele nabantu abasemngciphekweni wokugula kakhulu njengabantu abadala abanamashumi amathandathu ukwenyuka nabanye ke abanezigulo ezizezini.
Masikhathalele nabantwana singabayeki badlale phandle. Siqinisekise ukuba nabo bayazihlamba izandla zabo.
Zama kangangoko unako wena nosapho lwakho nihlale endlini.
Asizikhwebule ekupapasheni ulwazi olungenanyani kwaye sihlukane nezimvo zokuba utywala buyayibulala intsholongwane le. Abuyibulali intsholongwane.
Xa uziva unefiva, ukhohlela, unomzimba obuhlungu, unomqala obuhlungu, funa uncedo, utsalele inamba yasimahla engu-0800 029 999. Ndiyayiphinda inamba u-0800 029 999.
Uxanduva lwam, uxanduva lakho.
Lixanduva lethu sonke ukuzikhusela, sikhusele naye wonke umntu.
Masilumane ukulwela kwecorona.
And now for social media. Share your thoughts with us on Facebook, we are Our City CT, and on Twitter at Our City CT. This is the time that we need to come together as a nation. These are the popular hashtags on Twitter today. Lindela, a blame game is playing out over the recent escape of 37 foreign nationals being held at the Lindela Repatriation Center. The Home Affairs Minister has blamed guards who deny accusations, saying de-operated building and too few staff were responsible. Eskom. 60 retired engineers have volunteered to work at Eskom for free. They will be deployed to various power stations to help rebuild the ailing power utility. After the ad break, we'll be crossing over to Vicky McCullen, who will share information on resources and places of safety that you can use during this period. Stay with us.
Welcome back. You're still tuned to the Our City COVID show with me, Vicky McCullum. Before the ad break, Octavia and Lovu looked at what has the nation buzzing on social media platforms. For your latest news around the COVID-19 pandemic and to see what other Cape Townians are doing to keep safe, tune in to Cape Town TV daily. These are some organizations helping communities stay safe during this period. That's all we have for you today, but if you have something to say, we want to hear from you. Send your comments, news and questions to us via Facebook at Our City CT, on Twitter at Our City CT, or send us an email, ourcity@capetowntv.org. You can also call us on 021 448 0448. From me, Vicky McCullum and Octavia Ndlovu, goodbye.